Well, it might be that you're dealing with a high blood pressure or maybe even heart failure and your doctor prescribed you Ramipril, also known as Altace. Then this video is meant for you. We will cover how and when to use it, what side effects it can cause, what dosage you need, and much more. So make sure to watch the whole video so you don't miss any important information. For those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and it's my mission to medically educate you, my viewer, because educated people make healthier decisions. So let's get learning. So as mentioned, the generic name of this medication is Ramipril and it's sold under the brand name Altace, and it's available as a tablet or a capsule. If you want to use it as a tablet, just swallow it whole with half a glass of water, and the same is true for the capsule. Also, make sure to take this medication at fixed times. This will make it less likely that you forget a dose. And if you do experience side effects like dizziness or nauseousness, it's best to take it in the evening. Now, Ramipril is part of a group of drugs called angiotensin converting enzyme inhibitors. These drugs widen the blood vessels, thus lowering blood pressure and lowering the strain on the heart. Therefore, Ramipril can be used to treat a high blood pressure, heart failure and nephropathy. Which brings us to the correct dosages to use. And here I want to mention that it can only provide you with certain guidelines. Always use the prescribed amount and frequency your doctor gave you, as your specific dose might depend on your indication of use, side effects you're experiencing, or the seriousness of your symptoms. However, when treating high blood pressure in adults, most doctors will start with an initial dose of 2.5 milligrams once per day, which if necessary can be slowly increased up to a maximum dose of 10 milligrams once per day. When treating heart failure, the initial dose is lower, about 1.25 milligrams once per day, which if necessary could be built up to a maximum dose of 5 milligrams 2 times per day. Now, Ramipril is a very effective drug, but unfortunately it could also cause some side effects. I will discuss some of the most common ones in this video, but if you're looking for a complete list, then check your leaflet, ask your doctor or your pharmacist. Commonly, it might cause a low blood pressure, chest pain, nausea or dizziness. Uncommonly, it could cause a heart attack, fast heartbeat, dry mouth, constipation, or inflammation of the abdominal organs. And rarely it could cause tremors, balance problems or tinnitus. Which brings us to the safety of use. And here it is important to mention that Ramipril can cause dizziness or fatigue, especially the first few days when you're using it. If you do experience this, then please do not drive, as it could be dangerous. Furthermore, alcohol widens the blood vessels and it can therefore increase side effects like dizziness, especially at the beginning of your treatment. And if you want to combine Ramipril with alcohol, then first do so in moderation to check its effects on you. Ramipril could also have interactions with other drugs you're taking, and it can be dangerous for pregnant women and women which are breastfeeding. Always discuss this with your personal doctor. Now, I hope you know now how to use Ramipril, but if you have any questions, let me know in the comment section. I will do my best to answer each and every one of them. For those of you that did learn something, that did find this video helpful, please click the like and subscribe button. It will help out the channel tremendously, and in return you will get a notification each week with an awesome new video. I also made a playlist, you can find it in the description, with more awesome medical videos. And for those of you that can't get enough, check out the Instagram as well, @HowToMedicate. As always, I will see you next week with a new video. Bye bye.